Often hidden, unseen, unspoken, mental health problems affect 1 in 4 people at some point in their lives. Any one of us could suffer from a mental illness such as anxiety or depression, psychosis or dementia. And so, with an ageing population, growing demand and expectation on our services, and no extra money, we've introduced a new, more streamlined and beneficial way of delivering mental health services in North Essex, right from the moment a patient is referred by their GP.
Services will be much easier to navigate. So we'll have a single point of access where all referrals go to, rather than the current scenario where we've got a number of receiving teams.
Now they will have a thorough assessment which will be done by one team, and it will then enable us to really think about and very carefully define the treatment that they will need, rather than them having a series of assessments.
After an initial comprehensive assessment, patients will be referred onto one of the specialist treatment teams, who either manage serious mental illnesses such as psychosis, non-psychotic disorders or dementia care. Those who may only need a short period of support will remain with the assessment team, and in many cases GPs will continue to provide primary care with support from mental health professionals.
I'm really excited about this work. Mental health is right up there with the agenda with the government. We're working really hard with the Mental Health Trust to make sure that people are seen in the right time, at the right place, by the right person.
Change is needed to make it easier to access the service. Also, it helps if a service user has got consistency and can deal with the same people, and also that the people get to know the service user. Therefore, you become an individual rather than a case.
To deliver the change needed, a completely new way of working has been introduced. Everyone in the different specialist teams is involved, from those in leadership roles to frontline clinicians and administrative staff.
The biggest change is working in one big team rather than smaller individual teams that we have at the moment. We'll have a breadth of senior clinical knowledge across the whole team, working with the junior members of staff, a lot of shared working, a very different way of managing caseloads where we'll be able to acknowledge and identify the highest risk patients, and that's shared across the multidisciplinary team.
So if you have a suspected memory problem or a diagnosed memory problem, you will receive the same excellent evidence-based assessment and treatment wherever you live and however old you are.
We're very much a team that is out and about because we feel it's really important that the service users are seen where they feel most comfortable, and that can be either in a centre near where they live, or they can be seen at home if that's appropriate, or sometimes they want to be seen somewhere where they're not recognised.
If you would like further information, please pick up a leaflet at any of our offices or log on to our website at nep.nhs.uk. You can also follow us on Twitter and Facebook.